Vasodilators, it targets blood vessels, either arteries, veins, or pwede both arteries and veins. So let's read. It is able to reduce pressure by relaxing vascular smooth muscle, thus dilating resistance vessels to varying degrees, increasing capacitance as well. So unsa ang pasabot? Ano nga ulit yung tawag sa resistance vessels? Is it arteries or veins? Resistance vessels. Related yan sa? Okay. That is related to arteries. Okay, very good. Okay, therefore, naatay drugs that directly dilates arteries via relaxing smooth muscles, resulting to lowering of the pressure on that certain area. So, lowering the blood pressure. Kaya antihypertensive effect yan kapag it is able to relax the blood vessel, particularly the resistance vessels. Okay? Now, kapag ang drug is able to target arteries, ibig sabihin, that alters the systemic vascular resistance, or this is also known as the afterload, di ba? Okay, so that is relative to arteries. Kapag afterload, it's the arteries or the SVR. Okay, so if you relax arteries, we are also lessening the pressure, okay, or the systemic vascular resistance or the afterload. Then, via relaxing the smooth muscles to a varying degrees, okay, increasing capacitance as well. Sabi dito, varying degrees, increasing capacitance as well. So, kapag capacitance, ito naman yung related sa veins. Okay, capacitance vessel, di ba? That is the veins. Okay, so based on our preliminary knowledge, no, on dilating veins, we are also increasing here the venous pool. Okay, when we dilate the veins, okay, that do increase the venous pool. Okay, the pooling. Okay, if increase yung venous pooling, okay, with its capacitance activity, then it will decrease, therefore, the factor cardiac preload. Okay, cardiac preload. Ayan. Okay, so that is the relationships, no, between arteries to afterload, dilating veins towards decreasing the cardiac preload. Now again, may mga vasodilators ha, nga ga-target, pwede arteries lang, pwede veins lang, or pwede both. Both na noon. Both. Okay? Since ang atong topic is vasodilator, so kindly realize that inside our body, we have determinant of vascular tone. Okay, ibig sabihin, in our body, we have certain factors, we have certain compounds na pwedeng mag-contribute sa constriction ng blood vessels, like constriction of the arteries, constriction of the veins. Or meron ding mga contributors sa body natin para mag-relax ang vessels. Okay, so I need to introduce this because sa regulation ng vascular tone sa body, mauni sila ang gina-target or gina-alter ng mismong drugs. Okay, so kung masabtan ninyo ang normal nga physiology, dali na lang din masabtan ang application ng drugs. Okay, so for the constrictors, ayan, constrictors, meaning to say, kapag constrictor, di ba, these are contributors to increase of BP. Kasi they are able to constrict man the vessels. So, increase BP. Okay. So, for the constrictors, we have number 1, the endothelin. Yan, endothelin 1 particularly. This is a potent vasoconstrictor. Okay, this is a potent vasoconstrictor. Another determinant ng constrictor, okay, is when the alpha-1 receptor are being activated. Okay, di ba? Pag stimulated yung alpha-1 receptor, there is vasoconstriction. Di ba? Yan yung response. Okay, so these are few of the most common na nagkukos, no, ng vasoconstriction, okay, or regulators ng vasoconstriction, alpha-1 receptor stimulation, endothelin 1. Okay, now what about for dilators? For dilators naman, number 1, we have the nitric oxide. Okay, nitric oxide, that's NO. Okay, and then we also have the prostacyclin. Okay, we have the prostacyclin, or this is also known as the PGI2. The PGI2. And then the endothelium-derived hyperpolarizing factor that causes hyperpolarization of cell. Okay, all in all, this causes hyperpolarization, okay, of the cell. It could be a vascular cell or a muscle cell. Then we also have adenosine, and then lastly, the beta-2 receptor stimulation. For beta-2 receptor stimulation, this is manifested by the blood vessel that supply the skeletal muscles. Okay, ito yung related sa blood vessels supplying blood in our skeletal muscles. So again, for the determinants of dilation or relaxation, these are nitric oxide, prostacyclin, the hyperpolarization, adenosine, and also the beta-2 stimulation in the skeletal muscles. Okay, skeletal muscles. Now, syempre, ang ato ang topic, di ba, are vasodilators. So we will be more focusing on those contributors na nagpro-promote ng vasodilation. Okay, particularly among this listed nga contributors towards vasodilator, we will give focus on the following: the nitric oxide and the hyperpolarization. Okay? So bago ulit yung drugs, discuss natin paano nagkukos ng vasodilation si nitric oxide, paano din nagkukos ng vasodilation yung hyperpolarization. Okay, para later on ma-appreciate ninyo dali ra ang drugs. Okay? Kaya na ay later on ma-mention ng mga drugs that are able to release nitric oxide. So you can now easily rationalize nga kapag ang drugs, it is able to release nitric oxide, nga niyang ginabuhat. That's why na ay relaxation. Kapag ang drugs ga cause of hyperpolarization, then may relaxation. Why? Because of this and that. Okay, so let's start with nitric oxide. Okay, ayaw lang sa ninyo siya i-mind itong nasa taas. Okay, kay later na ni siya, kanang nasa taas manggod kay mga drugs na siya application sa drugs. So focus lang sa taas sa nitric oxide, bakit siya nagko-cause ng vasodilation. Okay, so in this figure, imagine this is a smooth muscle. Okay, a smooth muscle. So yung goal natin is malaman yung reason how, no? Yung paano nagkukos ng vasodilation si nitric oxide. Now, when nitric oxide is being concentrated in the smooth muscle, take note, yung ginagawa niya, it can activate the enzyme guanylyl cyclase. Okay? This is guanylyl cyclase. I repeat, kapag concentrated ang nitric oxide in the smooth muscles, that activates enzyme guanylyl cyclase, GC, guanylyl cyclase. Now, this enzyme, okay, being activated by nitric oxide, ano yung importance niya? This is responsible for the catalytic reaction or the conversion of GTP to Cgmp. GTP, that is guanosine triphosphate. Guanosine triphosphate. Converting that to cyclic guanosine monophosphate. Okay? So, hindi ko na sulat ha. Cyclic guanosine monophosphate. Cyclic guanosine monophosphate. Now, so yung end product would be formation, no? Or conversion of the substance GTP into Cgmp. Okay, so we have now the endogenous substance Cgmp. Now, itong nabuong endogenous substance na to, take note, ito yung nagre-relax, no, ng blood vessel. Kaya may nakalagay, okay, arrow down with Cgmp, relaxation. Okay, in short, ang presence ni nitric oxide, oxide that induces or increases formation of Cgmp. Okay, and with Cgmp, kapag nabuo yan, relaxation will happen. Okay, now yung tanong, paano yung Cgmp nagpo-promote ng relaxation? Okay, how Cgmp promotes relaxation. Now, to answer this, okay, let's have this slide. I want you to refer to this slide. Okay, para di mo ma-overwhelm, kindly focus lang on this part. Okay, kana akong gibox. Kay andyan, di ba, yung Cgmp. Na ato namang gusto may balansa is how Cgmp ultimately results or causes relaxation. Okay, ayaw lang sa nang nasa upper portion, madiscuss na nato na siya under calcium channel blockers, which is on the latter part of this afternoon's discussion. So, ang atong ansiran, why Cgmp causes relaxation. So, tandaan, sa blood vessel, smooth muscle, in order to facilitate contraction, take note ha, sa isang blood vessel, okay, nga smooth muscle, in order to facilitate contraction in the blood vessel, it requires phosphorylation of the myosin light chain. Okay, I repeat, yung normal, okay, na facilitation in order to contract blood vessel smooth muscles, it requires phosphorylation of the myosin light chain. That's why yung nakalagay dyan, di ba? Yung myosin light chain, it has been phosphorylated. Now, para mag-contract, okay, dapat madagdagan ha ng phosphate group. Para mag-contract, dapat madagdagan si MLC, myosin light chain, ng phosphate group. Now, ano ngayon yung ginagawa ni Cgmp? O, tingnan sa pathway, di ba? Papasok siya sa story. Ayan. Ayan. Okay, di ba? Nisulod siya. Okay. Ang gagawin lang po ni Cgmp, dephosphorylation. Okay. Dephosphorylation. Okay? Ng ano? Dephosphorylation ng ano? Dephosphorylation ng myosin light chain phosphate. O, ano ang gagawin niya kapag dephosphorylation? Ano yung ibig sabihin ng prefix na de? Does it imply add or remove? Oh, very good. Remove. So, ang point is, aalisin, i-remove ni Cgmp ang phosphate group. Kaya yung matitira na lang after removal of the phosphate group, myosin light chain. Kanina, sabi ko, di ba, the reason bakit ang blood vessel smooth muscle nagko-contract dahil phosphorylated ang myosin light chain. So pag hindi na, kapag myosin light chain na lang, what do you expect? Okay, so there would be relaxation. Okay, therefore the vascular muscle, smooth muscle, relaxed. Okay. So that is why Cgmp in general, it causes relaxation. Okay, so recall na to ha, di ba? We started with nitric oxide. Okay, ayan. We started with nitric oxide, and with nitric oxide, di ba, it is able to activate the enzyme guanylyl cyclase. And it is the guanylyl cyclase, okay, that converts the guanosine triphosphate into Cgmp. Now ngayon, with Cgmp, ito yung nagkukos ng relaxation. How? Dephosphorylation po ng myosin light chain phosphate, okay, para may relaxation na mangyayari. Okay, so dephosphorylation, tang-tang, phosphate, that's why there would be relaxation. So, yan lang po yung summary. Okay, so later, may mga drugs that will be mentioned, hypothetical, halimbawa, we have drugs that, yes, Ms. Caballero?
Ma'am, regarding sa relaxation, blood vessels ang mag-relax
Yes.
po.
Yes,
Apel ang smooth muscles po.
blood vessel is a smooth muscle cell.
Oh, okay. Thank you.
That is a vascular smooth muscle, ang blood vessel. Okay? Sige. Sige, thank you for that clarification, Ms. Jara. Okay, so halimbawa, later may ma-mention nga drugs, hypothetical lang ha. So, halimbawa, ang isang drug, it is able to increase nitric oxide in the body. So, we expect then that that particular drug is a relaxant drug. Okay, so that is the action of nitric oxide. Okay, that is the action of nitric oxide. Relaxant. Okay, relaxation, dilator. Okay, moving forward, another determinant of vasodilation is hyperpolarization. Okay, so hyperpolarization. So, kani siya nga term, I can still remember, pero ni siya ma-encounter sa anatomy and physiology, if you can still remember also. No, sige ni siya ma-discuss under sa cell nga topic, hyperpolarization. Sige, ato lang siyang i-recall. First, yung cell in relation to the differences of membrane potential. Kasi this is a membrane potential, yung hyperpolarization. So para mas maintindihan siya, let's recall all about cell. Okay? So cell, ayan. So halimbawa, the cell that I am talking about is the vascular smooth muscle. Okay? So halimbawa, I am talking about vascular smooth muscle. It could be blood vessels or it could be blood vessel veins or arteries. Now, may iba-ibang membrane states. Okay? Yung cell, no? Yung vascular smooth muscle. So, when we say membrane states, yan yung mga states, okay? Or status na we can tell, okay? We can indicate na yung cell is excited ba, yung cell ay stimulated ba, or yung cell is relaxed. Okay, depende yan sa membrane potential. Okay, so tandaan mo na to, when the cell is at rest, okay, when the cell is at rest, okay, siya ay negatively charged. Okay, negatively charged. And then, kapag ang cell naman is stimulated, kapag ang cell is stimulated, tandaan, yung charge niya is less negative. So, kapag less negative, then we can also say na somehow positive, no? Positively charged naman. Okay, stimulated or excited, parehas lang yan. Okay, stimulated or excited. Now, pag sinabing at rest, somehow ang smooth muscle ay relaxed, di ba? At rest. Resting, relaxed. Kapag stimulated naman, ang smooth muscle ay contracted. Okay, contracted. Sige, ako illustrate ha. Illustrate na ako. Ano yung nangyayari sa cell kung depressed, okay, or relaxed, or ano yung nangyayari sa cell kapag excited or stimulated. Sige, halimbawa, itong y-axis, okay, dito yung, halimbawa lang ha, dito yung positive potential, okay, and then dito naman sa baba, ito yung negative, ayan, negative potential. Okay? So, when we say positive potential, halimbawa, kung kani nga box represents a cell, halimbawa ha, kana nga box, that is a cell. Okay? Yung vascular smooth muscle cell. Okay? Kapag positive potential, ibig sabihin, yung inside ng cell, okay, is highly positive. Okay? The inside of the cell, highly positive. Kapag naman negative potential, okay, we expect na ang nagdo-dominate na ions inside the cell are negative ions. Negative ions. So, yan yung positive, negative potential. Now, when the cell is at rest, susulat ko, halimbawa, the cell is at rest first. At rest. Now, we expect that the inside of the cell, therefore, is negatively charged. Diba? Sabi natin, kapag at rest, negatively charged. So, negative. Okay? Ayan, negative. Now, ang tawag sa cell, if at rest, okay, ang tawag dyan is polarized. I repeat, ang tawag sa cell if at rest, okay, if at rest siya on this state, polarized. Polarized. Now, kung sakali po, if ever mag-shoot up ang graph, so halimbawa, di ba, at rest, so straight, okay, straight line yung rest, so negative yung inside ng cell. Kung sakali nag-shoot up ang graph, let's say, okay, shoot up, ayan. So, ibig sabihin, from resting state, na-stimulate ang cell, di ba? From resting na straight line, negative yung inside ng cell. Pag shoot up, from resting, nag-stimulate ngayon yung cell. Kumbaga, dumami yung positive ions inside ng cell. Okay? Kasi kapag nag-stimulate, positive, less negative na, no? So in this regard, we are removing the negative ions. We are removing the negative ions inside the cell. Question, kung we are removing negative ions from inside the cell, ano yung prefix nga i-add sa word na polarized? It is de. Therefore, kapag nag-shoot up, this is already, what is the word? Depolarized. Okay, I know you have heard these terms. Depolarized, polarized, hyperpolarized. So ito yun, ito yung concept. Okay? So nag-remove ka ng ions, depolarized. Okay? Kasi nga, naging positively charged na ngayon yung cell. Now, ang positive ions inside the cell would imply na na-stimulate ngayon yung cell. Stimulate, nag-contract. Okay? Nag-contract. Now, syempre, dili man all the time na stimulated always ang cell. Kahago ba? As stimulated ang cell, 'di ba? We have parasympathetic, 'di ba? So, naay time nga mag-relax ang cell. Okay, ang tawag doon ay repolarization. So, from that shoot up, okay, mag-relax siya, balik siya, okay, sa iyahang state. So, kapag bumalik, okay, mag-relax siya mula sa depolarized state, then ang tawag dyan is repolarized. Tawag dyan is repolarized or repolarization. Okay? Ayan. Now, in some other situations naman, ang graph, okay, di ba, nanatiri ang graph, ang point, okay, of reference sa graph, na ay mga cases, na ay mga situation na mas mababa pa from the normal relaxation or from the normal state, okay, resting state, from the normal resting state. So pag moingon ganita og mas nibaba pa sa normal resting state, it is already beyond at rest, no? That is beyond at rest. That's why yung expected na makikita natin sa inside ng cell sobra kadami yung negative ions. Okay? O, kapag sobra kadami yung negative ions, ano yung prefix na gagamitin kapag sobra? It is hyper, di ba? Very good. So, hyper. Kaya ang tawag dito na state is hyperpolarization. Okay? Hyperpolarized, hyperpolarization. Okay? Sobrang daming negative ion sa cell. Okay? O, di ba sabi ko kapag negatively charged, okay? Negatively charged, ano yung mangyayari sa cell? Relaxed. Okay? Pag negatively charged, relax. So, in the second determinant for vasodilation, di ba, hyperpolarization. Therefore, we expect here na pag na-hyperpolarize ang inside ng cell, it results to relaxation. Okay, it results to relaxation. Okay, sige, let's proceed on the left side na figure. Okay, focus now on the left side figure. Now, in the vascular muscle, okay, vascular smooth muscle, we can achieve hyperpolarization. How? By promoting outflow of potassium ion. So, via potassium ion channel opening. I repeat, we can promote hyperpolarization in a vascular smooth muscle. How? By promoting outward flow of potassium ion, okay, or simply opening the potassium ion channel. Okay? Now, opening of this potassium ion channel, okay, if we open that will lead to outward flow, of course, ng potassium ion. Lalabas ang potassium ion. Di ba? Piso. Potassium is normally found in the inside of the cell. Okay? Intracellular, di ba? Na cation ng potassium. So kapag nag-open yung potassium ion channel, magsisilabasan yan yung potassium ion. Ano ba yung daladalang charge ni potassium ion? Ano yung daladalang charge? Positive. Okay? Therefore, palabas ang positive ion. So ano yung implication, okay, sa inside ng cell pag nagsilabasan yung positively charged potassium ion? Bababa yung intracellular potassium ions. Kaya less positive na yung inside ng cell hanggang more and more negative charge will dominate inside the cell kasi nagsisilabasan yung potassium ion. Potassium ion is a positively charged cation, no? So palabas, what will happen sa inside ng cell? Less positive na ngayon. Okay? Until such time, mag-dominate na yung negative charge. So mafe-favor yung less positive ions. So kung less positive ions yung inside ng cell or negative ions yung magdo-dominate, that term is hyperpolarization. Okay? So ma-apply ninyo later sa mga gamot. Okay, example, later na i-mention na ang gamot, ang mechanism of action niya is promoting potassium ion channel opening. One pira na, no? Ayan, di na takabalog spelling. Opening, one pira din na. Okay, so halimbawa, yung MOA ng drug, it is able to open, no, the potassium ion channel. So what do we expect if ma-open ang potassium ion channel sa blood vessel? Relaxed. Okay? Relaxed. Okay? Kasi nga, na-hyperpolarized ang cell. Na-hyperpolarized kasi negatively charged yung inside ngayon ng cell. Bakit negative? Nagsilabasan, no, yung potassium ion. Okay? Lesser na ngayon yung potassium ion inside ng cell. Alright? So, we have discussed already the two mechanisms ng vasodilation. Okay, now I will now introduce the drugs. Okay? So, let's proceed to the drugs already. The drugs na vasodilators. Now, we can classify vasodilators into 3 groups. Okay, we have 3 groups. Now, with regards to calcium channel blocker, we have a separate segment, no? Wherein we will discuss CCB sa latter portion ng discussion natin. Okay, so ako lang siyang i-separate o discuss. Then for arteriolar or direct vasodilator, under this, we have hydralazine, Minoxidil, Diazoxide, Phenol Dopam. Then for non-selective, okay, vasodilators, meaning mixed vasodilators, we have sodium nitroprusside, alpha adrenoreceptor blockers. Now, di na ako ni i-discuss ang alpha blockers, no? Na-discuss naman ni sa sympathoplegics, okay? And na-discuss po ni siya sa inyuhang PCOL-1, okay? So, just know nga, they are also vasodilators, particularly non-selective. Okay, so please know what are examples of alpha blockers. Okay, so you scan over your notes. And then for nitro vasodilators, this will be discussed under anti-anginals. That will be next week. Okay, after our assessments, quizzes. So we will proceed directly on anti-anginal. So dira na ako ma-discuss yung nitro vasodilators. So for now, for mixed or non-selective vasodilators, I will just discuss sodium nitroprusside. Okay? So iscan lang dayon ninyo inyuhang notes for alpha blockers. Then for the following week, ma-discuss ko yung nitro vasodilators. Alright? Now, this table, this shows the mechanism of action already. Okay? The MOA. Okay? Of the different drugs mentioned. So ito na yung MOA nila. Mechanism of action. So, na-introduce ko na, di ba, yung mechanism of action ng vasodilation. So, number 1, halimbawa, pag sinabing it has something to do with the release of nitric oxide. So, you know already what will happen. Okay? So, na-discuss ko na, di ba, how nitric oxide causes vasodilation. So, ito na lang yung i-memorize nyo, what are those drugs with this mechanism of action na release of nitric oxide? We have hydralazine, sodium nitroprusside, and nitrates. Then, we also have drugs that promote potassium ion channel opening. Ito yon, yung hyperpolarization. So, halimbawa ng mga drugs na yon that promotes opening of potassium ion channel, take note, minoxidil sulfate, diazoxide. Okay, so no problem ha. You know this already why hyperpolarization causes vasodilation. Okay, then for CCBs, again, separate na ako ni siya i-discuss later. Okay, later. Then finally, for the activation of D1 receptor, the dopamine 1 receptor, we have Phenol Dopam. Okay, regarding Phenol Dopam, by activating the dopamine 1 receptors, that causes renal vasodilation. Okay, renal vasodilation. So, kumbaga, end result, there could be diuresis also. Okay, ayan. Okay, so these are the mechanism of action brought about by vasodilating agents. So please take note of this specified drugs and what are their mechanism of action. Nakasummarize na po dito sa table. Okay. Now, let us discuss the clinical applications of each mentioned drug. So we'll start by category, by the site of action nila. So for hydralazine, minoxidil, diazoxide, phenol dopam, diba, these are arteriolar direct vasodilator, meaning they are pure arteriolar dilators. They only dilate arteries. Okay, they only dilate arteries. Kaya direct arteriolar vasodilator. Now regarding pure Please take note regarding the pure arteriolar vasodilators. Dilators, okay, na ay very important nga note na dapat ninyo i-take, always keep in mind. Okay? I repeat, sa pure nga mga arterial vasodilators, please take note. Okay? They causes drawbacks. Okay? They causes drawbacks or certain adverse effects. Okay, yung mga pure arteriolar dilator. So, yung known, very known nga drawback or adverse effect ng mga pure arterial vasodilators na nagkukos yan, okay, or nagkakaroon ng drawback or adverse effect sila if they are taken as monotherapy. Okay, I repeat, yung mga drawbacks, yung mga known drawbacks or adverse effects na kinokos nila, that only results if taken as monotherapy, yung mismong vasodilator. When you say monotherapy, ibig sabihin tinitake siya as solo drug. Okay, solo use or solo drug. Kumbaga wala siyang kasama, wala siyang ka-combination drug. That's the time talagang very common, no, yung adverse effects nila. Okay, so if that is the case, solo use, particularly, yung mangyayaring drawbacks are the following. Or these are adverse effects, no? Very known adverse effects for those agents that dilate arteries only. We have number 1, yung reflex tachycardia. Reflex tachycardia. And second, peripheral edema. Peripheral edema. Okay, question. Bakit nangyayari yung mga drawbacks na ito? Bakit these two are the most common ones, okay, na kinokos or adverse effects ng pure arteriolar vasodilators. Okay? Actually, it has something to do with the compensatory mechanisms ng body. Naalala yung dalawang compensatory mechanisms ng body in relation to BP control. Ang sa ganito, ang duha ka compensatory mechanisms, we have, okay, nakalimot na mi ma'am. Ang sa ganitong duha, the very good. The baroreceptor reflex, okay, and RAAS. Okay. Take note. Yung mismong drawbacks na to, it has something to do with the compensatory mechanisms ng katawan with regards to regulation of the blood pressure. Okay, so we have the baroreceptor reflex and RAAS. Now, since we are talking about arteriolar vasodilators here, di ba pag na-dilate ang arteries, what do we expect na arterial pressure? Siyempre, mababa or decreased yung arterial pressure, with pure arteriolar vasodilators. Now, tandaan na pag mababa ang arteriolar pressure, this is one of the stimulus na pwedeng maka-activate sa baroreceptor reflex. Naalala? This could activate, no? Kana nga stimulus, okay, that could activate baroreceptors. Baroreceptor. Okay, reflex. Okay, so baba ang arteriolar pressure na na-detect niya. And remember, baroreceptor reflex, that is a negative feedback mechanism ng katawan. So pagbaba na arterial pressure ang iyahang na-detect, activated yung mga sympathetic efferent nerves, di ba? So activated yung sympathetic nervous system. Kaya ultimately, nagkakaroon talaga ng reflex tachycardia. Okay, reflex tachycardia. So ito na yun, di ba? So that is what happens on the right side of the figure. Okay, negative feedback mechanism lang po yung nangyari resulting to reflex tachycardia. Okay, then on the left side, ito ay dahil sa RAAS, no? That is because of RAAS. Okay? 'Di ba? Kailan na-activate yung RAAS? If there is beta 1 activation or yung renal hypoperfusion. Okay? Kung mababa yung pressure sa kidney. Okay? So, kapag may mababa na pressure sa kidney as well, 'di ba, that could trigger release of renin. Then, domino effect. Kapag may renin, may angiotensin 2. Pag may angiotensin 2, may aldosterone. What is the end result? 'Di ba? There is high BP, there is sodium retention. Okay? Renal sodium retention. In which, this is an indicator of peripheral edema kapag may sodium retention. Diba? Pag may sodium, water retention, peripheral edema. Okay? So again, ito yung dalawa sa pinaka-common, no, na drawbacks, no, ng arteriolar dilators kapag solo use, kapag monotherapy. Now, itong mga drawbacks na to, since very negative, 'di ba sila? Kay negative gud ang ilahang impact kay supposedly gagamit gani ta og arteriolar vasodilator para ma-lower ang BP. Now with these drawbacks, ma-defeat na noon ang purpose, no, sa atong ginatik nga tambal. So ang solution diri is combination therapy. Okay? There has to be combination therapy. Dili lang monotherapy, binibigay po yung mga pure arteriolar vasodilator para maiwasan yung mga drawbacks na to. So, dapat may ka-partner siya. Okay? That's why, di ba, sometimes when you encounter actually yung mga antihypertensives, kapag binasa niyo yung mga generic name nila, may mga plus, okay? May mga combination, may mga kasama sila. That is to prevent drawbacks. Okay. Now, for these drawbacks, for reflex tachycardia, pwede natin gamitin kasama with arteriolar vasodilator yung beta blockers. Okay. So to counteract the reflex tachycardia, so yung combination drug for an arteriolar vasodilator would be a beta blocker. Diba? Kasi ano yung effect ng beta blocker? Diba negative ino? Negative ino, so bradycardia. Okay, so pwede siya, no, to mask the reflex tachycardia drawback. And sa peripheral edema, what do you think? Ano yung pwedeng i-combine sa arteriolar vasodilator para bumaba yung blood volume or the fluid content? Ano yung class category? Very good, diuretics. Okay? Very good, diuretics. Yung very good nga combination drug for arteriolar vasodilator to mask peripheral or counteract peripheral edema. Susulat nyo, diuretics, and yung hindi pa po na-discuss natin, the ACE inhibitors and the ARBs, no? ACE inhibitors and also ARBs pwede din. Okay? ACE inhibitors, angiotensin-converting enzyme inhibitors, and then ARBs, angiotensin receptor blockers. Okay, so next meeting, madiscuss nato ni sila. I know, next meeting, madiscuss nato yung ARBs, di ba? Yung anti-anginal next meeting. Okay? Now, I repeat, pwede na sila i-combine ha, kaning nasa right side, okay, sa mga arteriolar vasodilator para maiwasan ang reflex tachycardia, maiwasan yung peripheral edema. So what are examples of pure arteriolar vasodilator? Diba, we have 4, yung Minoxidil, Hydralazine, Diazoxide, tsaka Phenol Dopam. So let us discuss the important concepts under each examples ng arteriolar vasodilator. So let's have first Minoxidil. Minoxidil, that is an orally orally administered nga active vasodilator. Okay, another thing, aside from its antihypertensive activity, ginagamit din siya for alopecia. Okay, ginagamit siya for the treatment, okay, of alopecia. Di ba? Alopecia, ito yung baldness, hair loss. Baldness, hair loss. Okay, so pwede gamitin yung minoxidil because minoxidil, it can stimulate hair growth. Brand name sa America is Rogaine. We also have in the Philippines, but it's not Rogaine, it's Regrow. Diba? Nani siya sa Watsons, kanang hiling mamalit sa Watsons bitaw. Kabantay mo ani, murag na siya sa counter, ingani gay siya pagkasulat, somehow, more siya, something, ana bitaw, Regrow. So murag nakasumpay-sumpay siya. Okay, dili siya tinagsa. So, nga na iyahang pagka-spell out. That is the brand name, Minoxidil, for alopecia. Available na siya. Ginapahid ra na siya sa ulo, sa hair. Okay, ginapahid sa ulo, sa hair. Then, we also have the tablet form. But yung tablet form, that is used for antihypertensives. Okay, yung tablet form, that is used for antihypertensive, the minoxidil. Then for the adverse effects of minoxidil, this includes the following. So yung edema, yung tachycardia, so na-discuss na ni siya kanina, di ba? Pure arteriolar vasodilators, drawbacks, peripheral edema, reflex tachycardia. Okay, so no problem with that. For this, okay, flushing, this is another adverse effect ng minoxidil. Flushing, it means redness. Okay, yung pamumula due to cutaneous vasodilation. Okay, namumula because of the cutaneous vasodilation. Okay, and then we also have a headache. And finally, ito yung side effect ng minoxidil if it is used for alopecia. Okay, if it is used to treat alopecia, yung adverse effect is hirsutism, hypertrichosis. Okay, kaya yung best na application talaga, if you wanted to treat baldness, alopecia, dapat yung i-buy nyo na agent, okay, must be topically applied. Okay, kaya meron tayong topical application ng minoxidil. Okay, so yan yung best way para maiwasan yung hirsutism, hypertrichosis. Okay, yung pahid-pahid lang sa ulo, okay, sa hair. Next, we have hydralazine. Okay, hydralazine, okay, another na po ni siya nga pure arteriolar vasodilators. Okay, take note, effective ito for severe hypertension. Okay, severe hypertension like hypertensive emergencies. Okay, hypertensive emergencies. Okay, usually, very common nga hypertensive emergency patient na ginagamitan ng hydralazine are those pregnant women. Okay, pregnant women. Diba na-mention sa sympathoplegics nga recorded video, hydralazine is a safe drug for pregnant women. It is a safe antihypertensive drug for pregnant women. Okay. Also, an effective agent din ito for the treatment of heart failure. Okay. Take note, it is an effective agent for heart failure if only combined with nitrates. If it is combined with nitrates. Okay, so sulat nyo, particularly yung nitrates, okay, that I am referring is the isosorbide dinitrate. We will discuss this under antianginals. Okay, so utang ko muna yung mechanism of action ng nitrates. But somehow you already have an idea, diba? They are able to release nitric oxide. Nitrates release nitric oxide. Okay, so I repeat, hydralazine, effective agent for heart failure if only combined with nitrates, particularly the isosorbide dinitrate. Okay, and take note also, this combination is effective only, not for Filipinos, but for African American. Okay, African American. Okay, that's why dili kayo familiar si hydralazine isosorbide dinitrate as combination drug no sa Filipino setting, sa Filipino patients with heart failure. Iba naman no yung first line na combination drug for patients with heart failure. So we'll discuss that under drugs on heart failure. Okay, so please take note of this. Okay, next, for the adverse effects naman, there could be lupus-like syndrome. Okay, so this is one of the adverse effects ng hydralazine, lupus-like. Meaning to say, hydralazine can cause effects or mga adverse effects, side effects that looks like the clinical symptoms of the patient having lupus. Okay? Yung systemic ba? Systemic lupus edematous, SLE. Okay? So katulad ng lupus, yan yung kinokos na adverse effect ni hydralazine, SLE. Now, there are other drugs that also cause lupus-like syndrome. So yung mnemonics nyo dito, HIP. Okay? HIP, mnemonics for those drugs that causes lupus-like syndrome or SLE. No? SLE, systemic lupus edematous. So we have hydralazine, isoniazid, procainamide. Okay, procainamide. Now, also, with regards to cardiovascular effects, meron din siyang adverse effect yung hydralazine. So with reflex tachycardia, na-discuss na to sa compensatory mechanism, diba? Somehow. Then for the CNS effects, adverse effects, hydralazine can manifest effects like headache, nausea, anorexia, or the appetite suppression. Okay, appetite suppression. So that's for the hydralazine. And then for diazoxide, we have, this is another pure arteriolar vasodilator. Ito, the same with other common nga antihypertensive agents used for hypertensive emergency, parenterally administered din po siya. Kapag kasi hypertensive emergency yung pinanggagamitan, parenteral gid na. Okay? Emergency case naman na. So, dili na nato na siya ipa-intake, pugso nimo ipainom og tablet. Okay? So, emergency naman, so parenteral. Okay? Then just like other drugs also, please take note na lang yung MOA nila sa katong table nga akong gi-present kanina. Okay? So, dili na nako i-discuss ha yung MOA. Katulad sa Minoxidil, tsaka hydralazine, wala na nako emphasize diri sa per slide ilang MOA kay na-discuss naman doon sa table, kato akong gipakita nga table, summary na yon ng MOA nila. Okay? Now also, ginagamit siya for treatment of hypoglycemia. Okay? Take note. Treatment for hypoglycemia secondary to insulinoma. Okay, again, it can also be used to treat hypoglycemia secondary to insulinoma. Bakit siya pwede gamitin? Okay, it is because si diazoxide, as stated, it is able to inhibit release of insulin from the pancreas. Okay? Remember, di ba, yung insulin, this is a hormone, okay, that is responsible to lower the glucose, no, in the blood, the glucose level in the blood. Yan yung action ng insulin. Okay? Therefore, based on its action, okay, kung kaya niyang i-inhibit si insulin, okay, meron gid siyang capability to cause hypoglycemia. Okay? Now, paano siya nag-re-release? Paano ba nare-release yung insulin sa pancreas? Okay? For you to understand the mechanism of action ng diazoxide in relation to treating hypoglycemia. Okay? So, please take note. Summary lang ni siya. Dili ni siya yung detailed yun nga discussion sa insulin release. But I will just give you a summarize nga idea para naamoy something understanding on this concept. Okay, so let us learn first how the insulin is being released from the pancreas, particularly from the beta cells ng pancreas. Halimbawa, yung box na yan that represents beta cells of the pancreas. So halimbawa lang, beta cells yan ng pancreas. And then, I will draw blue dots. Yung mga blue dots dyan, yan yung mga insulin. Okay, insulin, insulin. Okay. Tandaan na highly regulated po ang secretion ng insulin. Kontrolado yung secretion, yung release ng insulin from the pancreas. Okay? And dapat po may mangyayaring trigger. Dapat may trigger nga ma-feel si beta cells para ma-release niya si insulin. Okay? And ang trigger na yan is depolarization of the beta cell. Okay? So yung trigger, depolarization, okay, of that beta cell. Okay? Now, paano ba yung depolarization of the beta cell? That is via blocking the potassium ion channel of the beta cell. So, halimbawa, sige, I'll draw here a potassium ion channel. Okay, daanan ng potassium. So, this is the potassium ion channel. So, yung kapag may depolarization, okay, na mangyayari sa beta cells, what really happens there is na-block yung potassium ion channel. Let me ask you, ano ba yung inside ng cell kapag depolarized? Positive or negative? Kapag depolarized. Very good. Okay, very good. Positive. Positive. Positive yung inside ng cell, depolarized. Okay, syempre, via blocking potassium ion channel, hindi makakalabas yung potassium ion, di ba? Via blocking that potassium ion channel, hindi magsisilabasan yung potassium ion from the beta cell. Kaya depolarized ang state ng cell. Depolarized, meaning stimulated, excited yung cell. Siyempre, excited yung cell, depolarized, stimulated, that will lead to release of insulin. Okay? Yan yung process paano nare-release si insulin. Okay? Ano nga ulit yung action ni insulin in the body? Binababa niya yung glucose, kaya may hypoglycemia effect, no? Yan yung normal na ginagawa ni insulin. Okay, kapag na-release si insulin, kapag stimulated, okay, depolarized has stimulated, na-release si insulin, hypoglycemia yan. Now, let's go back to the mechanism of action ng diazoxide. Saan related yung mechanism of action ng diazoxide? Does it related to nitric oxide or hyperpolarization? Nitric oxide or hyperpolarization? It is, very good, hyperpolarization. Diba? Sa katong table, nga summary, diazoxide, it is a vasodilator. Paano siya naging vasodilator? Kasi yung MOA niya, it promotes opening of the potassium ion channel. Now, because of that MOA also, pwede siya gamitin for this condition. I repeat, because of that MOA also of diazoxide, pwede siya gamitin on that condition. Okay? How? Siyempre, 'di ba, it opens the potassium ion channel. Yung ginagawa niya, it opens the potassium ion channel. So, imagine nyo, itong potassium ion channel, hindi siya blocked. Okay, erase ha. Ayan. Halimbawa, hindi siya na-block. Hindi siya na-block. Okay? Therefore, do you think the inside of the cell is still positively charged or not? Positive or negative? Kapag open yung potassium ion channel with diazoxide, yes. Okay? So, less positive na. So, meaning, magdo-dominate ngayon yung negative. Kaya nga, di ba, hyperpolarization yung ginagawa ng diazoxide. Hyperpolarization yung ginagawa ng hydroxide. Okay? So, hindi po madedepolarize this time yung beta cell. Okay? Ano sabi ko kanina? In order to release insulin, kailangan ma-depolarized. Daw wala man na-depolarize karon ang beta cell. Do you think may release of insulin pa rin? May release pa ba ng insulin kapag may hyperpolarization sa beta cell? No. Okay? So kapag hyperpolarization na yung mangyayari, syempre, hindi na mare-release si insulin. Kaya, it is capable to inhibit insulin release. Okay? So, with diazoxide ha, since pigil ang release ng insulin, okay, we can also say na meron siyang side effect. Diba? Iyamang ginapugnan ang release sa insulin. So, most probably, potential niyang toxic effect kapag nasobra masyado yung action niya, is it hypo or hyperglycemia? Very good. It's hyperglycemia. Iyamang ginapugnan ang release ng insulin. So, negative, walang insulin availability. Walang maglo-lower, kumbaga, ng blood glucose. So, hyperglycemia. Kaya nga pwede siya to treat the hypoglycemia secondary to insulinoma. Okay? So, please take note of this toxic effect. Potential si diazoxide with that toxic effect, hyperglycemia. Okay? Ayan. And then, for the adverse effects, so na-mention na to, hyperglycemia due to inhibition of insulin release. Okay na yan. For the reflex tachycardia, hypotension, it has something to do with its action naman, diba? Reflex tachycardia, it's because of the drawback. And then for hypotension, because of its mechanism of action. It is a dilator. Okay, relaxed yung vessel, so hypotension might really happen also. Then for the last pure arteriolar vasodilator is the Phenol Dopam. So I repeat, this is a dopamine 1 receptor agonist. So yung ginagawa niya, it causes renal vasodilation. Renal vasodilation. Okay? And also, it can cause natriuresis with that mechanism of action. Okay? And another thing, this is an alternative drug. Take note, this is an alternative drug for hypertensive emergencies and also for post-operative hypertension. Then for its toxicities, halos the same lang naman yung mga adverse effects ng mga pure arteriolar vasodilator. You can just read them out. Okay? So, those are the examples of arteriolar vasodilator. So we have 4 nga pure direct arteriolar vasodilators: hydralazine, minoxidil, diazoxide, and phenol dopam. Alright, so they target only arteries. Take note, they target only arteries. What are again the drawbacks common if monotherapy given yung mga pure arteriolar vasodilators? Okay, it's reflex tachycardia, very good, and peripheral edema. Very good. Okay. Next, let us proceed to the mixed-acting vasodilator. Ayan. So, pag sinabing mixed-acting or non-selective na vasodilator, ibig sabihin, it can target both arteries. Okay, it can target both arteries and also veins. Okay, and veins. Ayan. So under mixed, no, mixed acting, we have sodium nitroprusside or sodium nitroprusside, alpha blockers, which I will not be discussing na because you have already your notes. Then nitro vasodilators, again, it will be discussed under antianginal. So focus natin ngayon is the sodium nitroprusside. Okay. So sodium nitroprusside, take note, this is actually not available in the Philippines. Okay, hindi po siya available in the Philippines. Okay, so again, this dilates both the arteries, okay, and the veins. It dilates both arteries and veins, thus reducing vascular peripheral resistance and also the preload. Kaya nga yung affected dyan, na-alter yung SVR, afterload, at saka yung preload. Okay? Also, ginagamit ito as first line. Okay? First line in the hypertensive emergencies. Okay? Hypertensive emergencies, first line. Okay, so please take note. But again, this is not available in our country. We actually have alternatives. Okay, so which we will be discussing kapag mag-discuss na ta sa drugs on heart failure. Okay. Now for this figure, this is a representation of the structure of nitroprusside. Okay. So as observed in the skeletal form of structure, we can see three important parts or three important, ayan, substituents. Okay. So please take note on the structure of sodium nitroprusside, we have the ferrous. Okay, this is the ferrous. And then we have the nitro groups. Ferrous and nitro groups. Take note that two are the most important parts sa structure niya for its action. Okay? These are the two parts that contributes to the mechanism of action ng nitroprusside. Kumbaga, ito yung may relationship towards the MOA of the nitroprusside. Diba? Kung when we talk about the SAR ba, when you study the SAR, the structure activity relationship of sodium nitroprusside, ito yung mga nagko-contribute sa MOA niya as mixed acting vasodilator. And then we have the cyanides, yung mga cyanides naman in a ring structure. Ayan. Ito naman yung mga parts na nagko-contribute sa toxicity or side effect ng nitroprusside. Okay? So, again, I will not discuss the MOA ha. You know already the MOA. Okay? Diba, isa din siyang drug that able to release nitric oxide. Okay? Same with hydralazine. Okay? Release nitric oxide. Okay? Now, for their toxic effects, we have hypotension, metabolic acidosis, arrhythmia, and methemoglobinemia. Okay, so this may also happen. And the most serious one, yung serious talaga na adverse effect niya, is yung accumulation of cyanide. Okay, accumulation of cyanide. Remember, di ba, sa ring structure that I have presented to you, meron siyang cyanide ring structure sa nitroprusside. Kaya, pwede talaga mangyari yung accumulation of cyanide. Okay, so with this toxic action, yung ginagawa ng cyanide sa katawan is that it inhibits the enzyme cytochrome oxidase. Okay, yan yung toxic action ng cyanide. Yung toxicity, yung toxic mechanism of toxicity ng cyanide. it inhibits the cytochrome oxidase enzyme. Okay, ano ba yung importance ng cytochrome enzyme? Cytochrome oxidase enzyme, okay, that is actually the enzyme that is very important sa electron transport chain. Okay, that is very important, okay, for electron transport chain, yung ETC, biochemistry. Naalala, cytochrome oxidase. Kumbaga, very important siya for ATP synthesis. Okay, ATP synthesis. Di ba ang product ng electron transport chain, we are synthesizing ATP. Okay? But again, if na-accumulate si cyanide, kapag may cyanide accumulation sa katawan, nabablock, no, yung cyanide oxidase. Nabablock yung cyanide oxidase. Ay, not cyanide. Cytochrome oxidase rather. Okay? Kaya, pigil ATP production, pigil yung ATP production. So, yung end result, kapag inhibited yung ATP synthesis, that results to inhibition of cellular respiration. So, nakakamatay siya. No, nakakamatay yung cyanide poisoning. Inhibition of cellular respiration. Okay, kasi wala ng ATP. Okay, targeted yung ATP. Okay. Now, these are the three substances or agents that are used then for the treatment of cyanide poisoning. Okay, so itong tatlong agent, applicable sila for the treatment of cyanide poisoning. Now, among the list of treatments for cyanide poisoning, ang pinaka-most conventional one is yung cyanide antidote kit. Again, this is the conventional, okay, conventional agent for the treatment of cyanide poisoning. And ano ba yung mga components ng cyanide antidote kit? Okay, it contains 3 agents. Okay, it has amyl nitrite, okay, amyl nitrite, sodium nitrite, and also sodium thiosulfate. Okay, thiosulfate. Okay, so yan yung mga components, kumbaga, ng cyanide antidote kit. So, ang problema lang kay cyanide antidote kit, di ba, sobrang dami. Sobrang dami ng components niya. So, mura siya hassle gamiton. Hassle siya gamiton. Kaya yung commonly used one, yung commonly used is the hydroxycobalamin. Okay? Hydroxycobalamin, this is a form of vitamin B12, di ba? This is a form of vitamin B12. So that is used also for cyanide poisoning. And then lastly, we have methylene blue. Okay, methylene blue, this is also effective for the treatment of cyanide poisoning, provided that higher dose yung ibibigay with methylene blue. So, dapat ibigay siya at higher dose. Okay, but again among the three, the pinaka-common, okay, commonly used one is the hydroxycobalamin. Okay, so again, these are the applicable na treatments for cyanide poisoning. Okay? And the one that is considered a contributory factor which causes accumulation of cyanide in the body is yung sodium nitroprusside. Okay? Kasi nga, yung structure niya, maraming cyanide. Okay? Cyanide parts. Okay? So, that's the end, no, of sodium nitroprusside. Also, done with mixed vasodilators. Alright? Sige. So, let's continue. Still under vasodilators. Okay, still under vasodilators, proceed ta sa special section under vasodilators. These are the calcium channel blockers. Calcium channel blockers. These are also vasodilators. Okay. Now, basically, when we talk about CCBs, calcium channel blockers, these agents, of course, they block calcium ion channel. Now, calcium channel blockers, so they block the calcium ion channel. Specifically, they block the L-type. Okay, they block the L-type calcium channel. Alright? Particularly, yung calcium channel located in the cardiac myocyte. Okay, it is able to block those L-type calcium channel that is found or located in the cardiac myocyte, meaning in the heart, and those calcium channels, okay, that are located in the arteries. Okay, arteries. Ayan. Okay, so I repeat, kapag calcium channel blockers, these are the agents that able to block calcium ion channel in the cardiac myocyte and in the arteries. Now, pag binlock ang calcium channel in the heart, that can cause cardiac depression. Okay, somehow depressed yung puso. Okay? Or meaning relaxation, diba? That's equivalent to relaxation. Kapag again, binlock yung calcium ion channel sa puso, sa heart. Then kapag sa arteries naman, if block yung calcium ion channel sa arteries, then that leads to dilation, vasodilation. Okay? So, again, ito yung mga posibleng sites of action ng mga calcium channel blocker. Now, since we are discussing vasodilator, syempre, ang atong i-emphasize na target, okay, ng calcium channel blocker is yung pag-target niya sa arteries. Okay? Kasi ito yung related, di ba, sa vasodilating activity. Okay? So, for its activity sa heart, naapod tayo specific segment, no, na ma-discuss na to, yung CCBs, action ng CCBs sa heart. Okay? So, under pa rin yan ng cardiovascular drug, but not in here. Okay? Sa anti-anginal nato na siya ma-discuss. Okay? So, before we discuss the mechanism of action ng calcium channel blockers towards the arteries, explain muna natin yung role or importance ng calcium channel. Okay? Sa arteries. Okay? Sa arteries ha, yung role ng calcium ion channel sa arteries. So, yan yung i-establish muna natin. Okay? Ano yung ginagawa ng calcium channel sa arteries. So, ngayon, shortcut lang sa, please take note nga ang role ng calcium channel, not the drug ha, yung mismong ion channel. Yung role ng calcium channel, okay, is to promote contraction. Okay? Di ba? Pag may calcium, contraction. Calcium, that's for contraction, di ba, of vascular smooth muscles. So, okay, so let's discuss the role now. Okay, let us explain the role ng calcium ion channel. Okay, so paano siya, kumbaga, nagkukos ng contraction activity. Okay, paano siya nagkukos ng contraction activity? Bago natin i-block si calcium, kasi pag na-block, kapag nag-inhibit si calcium, di ba, opposite ng contraction, relaxation, dilation. Okay? So, dito sa role niya, okay, causing contraction. So, first stop, itong illustration na to. First stop, itong may oblong, okay, kulay green. Diba? You can see there an abbreviation SR. Okay? Halimbawa, itong buong illustration na to, okay? Kaning tibuok na illustration, imagine niyo na lang, this is a cell, okay? An artery. Okay? So, this is a cell, particularly the artery. Kasi nga, we are focusing on the vasodilating activity of CCBs. Okay, so yung action ng calcium channel sa artery, Okay? Now, inside the artery, the cell of the artery, di ba? You can see there yung may abbreviation na SR. Okay, sa oblong kulay green. Yan yung sarcoplasmic reticulum. Sarcoplasmic reticulum. Okay, again, ang tawag dyan, sarcoplasmic reticulum compartment. Diba? Now, inside the SR compartment, sobrang dami ng calcium ion na na-store or naka-sequestered dyan or naka-hide. Okay? That's why meron kang makikitang calcium ion, okay, inside the figure, no? Inside the figure ng SR. Okay? Now, we can also find here sa illustration the L-type, no? The L-type calcium channel ion. So, andito siya. Now, ano yung role niya? Ano yung role ni L-type calcium ion channel? Okay, yung role po niya, okay, yan yung magsisilbing gate or gate or channel para makapasok itong calcium na mula sa labas ng cell. Okay, that will serve as the gate of the calcium coming from the outside of the cell. Now, ang tawag natin sa calcium na to, galing sa labas, that is what we call the trigger calcium. Okay, yung galing sa labas, trigger calcium. Daw, bakit trigger calcium yung tawag? Kasi pampastimulate siya ng release. Okay? Pampastimulate siya ng release of calcium, to be specific. Okay? So, trigger calcium yung tawag sa kanya. So, this trigger calcium, tingnan, so nakapasok na siya via L-type calcium channel. Okay? Nakapasok siya via L-type calcium channel. Now, kapag nakapasok ang calcium dito, this will trigger the release of calcium ion stores from this SR. Okay, kasi nga 'di ba, trigger calcium siya, so siya yung magpapa-stimulate ng release of more calcium inside the cell. Nasaan ba yung mga more calcium inside the cell? They are sequestered here. No, they are sequestered here sa sarcoplasmic reticulum. So, matitrigger ngayon yung release ng mga calcium stored in the sarcoplasmic reticulum. So, ibig sabihin, without the trigger calcium, ang mga calcium stores from the SR mananatiling naka-hide inside the SR. Hindi po sila makakalabas without trigger calcium. Okay, so suppose nakapasok na dito si trigger calcium. Again, as a result, lalabas yung calcium from the SR going to the cytoplasm. Okay, so may mga calcium na sa cytoplasm ng cell. Okay, may calcium ion na sa cytoplasm. Now, presence of the calcium ion in the cytoplasm, that will cause interaction with calmodulin. CM, that is calmodulin. Okay, kaya may nakalagay dila, nag-interact sila, di ba? Calcium. This is already the calcium inside the cytoplasm, ha? Then, reacting that to calmodulin. Okay, I repeat, calcium will interact with calmodulin, forming now a complex known as calcium-calmodulin complex. Calcium-calmodulin complex. Now, this particular complex na nabuo, it will activate an enzyme. Listen, it will activate an enzyme, and that enzyme is known as myosin light chain, MLC, myosin light chain kinase. So, ulit ko ha, myosin light chain kinase. That is the enzyme na ina-activate nino calcium calmodulin complex. Oh. sa biochem, ano yung naaalala nyo sa kinase enzyme? Ano yung particular functional group nga gina-transfer ng kinase enzyme? Diba? It is able to transfer phosphate group. Very good. It transfers phosphate group. Yan yung tatandaan nyo about kinase. Okay? O again, take note. Yung MLC kinase enzyme, ga-transfer siya og phosphate group. Okay? That is why, okay, yung myosin light chain, tingnan sa reaction, yung kulay orange nga arrow, tingnan sa reaction, nadagdagan siya, na phosphorylate siya, nadagdagan po siya ng phosphate. Na-mention ko to kanina. Whenever the myosin light chain is phosphorylated, the action is contraction. Naalala? Na-mention ako kanina, di ba? Kapag phosphorylated ang myosin light chain kinase, contraction yan. So yan yung role, okay? I mean, the reason, no? Behind the role of calcium ion channel. Okay, so yan yung role ng calcium ion channel. Kapag na-activate yung calcium ion channel sa vascular cell ng artery, contraction will happen, and that is the step-by-step no, nga process. Okay, ito naman, itong part na to, ito yung diniscuss ko kanina with regards to the role of nitric oxide. Ito yun, yung nasa baba. Diba, remember? Diba sabi ko, with nitric oxide, diba isa siyang regulator ng vasodilation. It able to activate the enzyme guanylyl cyclase. And with guanylyl cyclase, it promotes the formation of Cgmp. Ano yung tinatanggal ni Cgmp? Anong group ng MLCP? It is the ano yung ginagawa ni Cgmp? Very good. It's the phosphate na tinatanggal niya. Kaya mag-a-undergo dyan ng dephosphorylation. Kaya tingnan yung black na arrow. Okay, arrow to the left. Arrow to the left. From myosin light chain phosphate, removal of phosphate group from that MLC phosphate, it causes relaxation. Diba? With nitric oxide, relaxation.